Well, welcome, and thank you all for joining me today on this beautiful day. I have kind of an eclectic background. One thing I will say is I come from Old Salem. That's where I spent the brunt of my career before moving down here. Old Salem is in Winston-Salem, North Carolina, and it was settled by Moravians. And within that site, it's a little different today in how it was when I worked there. COVID has drastically changed how a lot of historical sites and especially ones like Salem where you've got it as a district. You're visiting various homes and businesses from the past. They're the original buildings. So I'm not sure how they do things now, but when I was there, I was split between educating folks about foodways of the past, which is what I truly embraced, but I also was in the medical field of educating what medicine was like in the 1800s from basically, I'm going to say 1805, I know that's a specific date, up until about 1880. So my knowledge pretty much encompasses that area. I tend to go back more so than go forward, just because a lot of the medical practices of the 1800s still have their bases, not just in medieval medical lore, but you can even go back to ancient times with your establishment of the humanic theory, and we'll come back to that in a little bit. And then also you have Galen, who produces in the 2nd century BC this book that is going to be the book almost all physicians are utilizing for various aspects of treatment, whether it's making up their own medicines at home or how they would treat a patient. You're also going to see influences coming from your Arabic areas, and that's going to be any type of physician or traveler that went to those areas, saw what they were doing. For instance, their advancement that you see, especially in the Ottoman Empire with smallpox vaccine and inoculation, that's going to be coming back over. So medicine leading up into the 1800s is not so straightforward as some people would like to think. It is a very encompassing, deep knowledge, if I can even use that as a way of wording it, form of study. In medicine, you're using the humanic theory, and the humanic theory is going to predate basically germ theory. And even though you do see in the 1860s and 70s Louis Pasteur starting to study into bacteria, we're not really going to see that play a factor within the American Civil War. And in fact, the American Civil War is going to help advance our medicine to the level that you see in Europe, because prior to the Civil War, which is 1861 to 1865, American medicine wasn't really held in very high esteem over in Europe. It wasn't where Europeans looked at us and were like, ugh, but they just were aware we're still trying to get our footing. We're still trying to advance ourselves. And more importantly, we're still trying to establish medical institutions where we can actually train our physicians and our surgeons. The humors are blood, phlegm, black, and yellow bile. It was believed if you became sick, it was not so much that something came into your system, like an illness or a bacteria or such like that. It was because you had an imbalance. And an imbalance meant that you were going to treat this patient with maybe medicine or something a little more drastic. So I'm sure everyone knows about bloodletting. Bloodletting was performed pretty regularly. George Washington sadly had a little too much bloodletting towards the end of his life. It depended on your physician how much they're going to use that as a medical tool. You do see records of physicians saying, oh, I took so many quarts from this patient and I think they look better. And of course, sadly, they would usually die about 2 weeks later. And then you had other physicians who were like, we're only going to use this in the most extreme case. I want to see if some other things will work out. And then I'll take more blood if need be. It's the same as today. You used to have some physicians that you're going to go and see, and they're just going to write you a prescription and push that medicine at you and say, go forth and take it. You'll have other physicians that are going to look at you and go, let's wait on that drug. Let's talk this through and see what other options we have. So keep that in mind as I'm talking, that the people of the 1800s have the same mindsets, the same emotions as we do today. They are not a totally different breed of species. They're not stupid. I get that a lot sometimes when people come and ask me medical questions. They were like, well, they were dumber back then. No, they were not. It's just culturally, it is different than how we are today. Now, another thing you're going to see evolving during this time period is the idea of an apothecary or pharmacy. You will see straight apothecaries, and a person that works in an apothecary is called an apothecary. They're not called an apothecarist. But you will see that either being their sole job. They were trained in it, whether they apprenticed or went to school, and their sole purpose is to acquire these ingredients, whether locally or imported, and concoct the medications. Or in a rural circumstance, you're going to see your physicians also being your pharmacist or apothecary. They may be purchasing pre-made medications, or they might be making their own concoctions just because they didn't have an area where someone was willing to move to set up a business basically to treat. And yes, you do have what we call snake oil salesmen during this time period too. And yes, you do have those that are training or not even really trained, saying they're medical professionals. America did not have the rules and regulations and the means to actually go out and regulate and make sure folks did have professional training before they went out and started taking care of patients. We still see that pop up once in a while today too, so keep that in mind. Trauma that you're going to see in a time of war is not the same as what you're going to see in everyday life historically. That's not to say doctors won't see a horrific accident involving, let's say, horse and carriage during this era, or we see the budding industrial revolution. You could see something occurring in an industrial location. But with a short amount of guesstimation, you can say most of your surgeons are probably going to be practicing about 20 surgeries in that number a year. Whereas you go into a time of war and it is just nonstop. You're getting a patient slammed on that table. You're doing what you can. They're moving the patient. They're bringing them in. The one benefit of that is we will, and I'll talk about this a little later, some things are going to occur that are going to make life a lot better for patients because you're going to have physicians, you're going to have folks standing back and going, we need to fix this and we need to make this work a lot better. And it's going to be the beginning of what we would later on call a combat medic. It's going to be the beginning of what we're going to see is our nursing establishment coming about. And it's also going to be where you're really going to start seeing a split within your surgeons and your physicians and medical fields kind of broadening out compared to the past. During this time period, you do see folks talking about cleanliness. Think of Florence Nightingale. She's working over in the 1840s over in Europe. She's going in and looking at places and saying, this is disgusting. You need to clean it up. Wash your hands, clean the sewage, get good food on the table, put clean linen on the ground. Now, she's not sitting there coming from a background where she's like, oh, I've studied bacteria. I know all about this. We need to be antiseptic. Antiseptics are going to come much later on. But through trial and error, thousands of years, people are kind of putting two and two together and realizing if you go at a patient with clean hands, they have a better chance of surviving than if you go at a patient with dirty hands. This isn't always going to be accepted. And also, again, if you're in the middle of a battle and you're trying to take care of your patients, there's not going to be the water and soap source that you need to take to wash your hands in between. You're not going to have 5,000 clothes in a closet like we do today that you can be like, oh, I got a stain, throw it off and throw another one on. You're going to see your doctors performing in very, very nasty circumstances. Yes, they are going to be blood splattered and they're going to have pus on their bodies. Some of them are even going to strip down and just be wearing pants at some point. They're not going to have time to clean their scalpels and such. So they're going to do everything that they can to ensure that patient survives. They're going to try to ensure that that patient survives after that trauma. But it's not like what you're going to see again from the battlefield, where your doctor maybe just have that one person he's going to perform a surgery on, and then basically they can kind of coddle them for a while after. And that's not to say even with being clean and such, without your antiseptics, you're not going to see an infection set in and a person's going to die. Up until World War II, and that's saying something, more of our soldiers are going to die from disease than they are going to die from wounds inflicted, in the sense of, not to be bloody, but blown up, let's just say, or a shot to the head and that just took them out. I mean, I have to admit, when I first started researching this, I really thought World War I was where I was going to see that turning point. But it's not until World War II where we are finally established on a level that we can have manufactured enough antiseptics, we can have manufactured enough clean bandages, and we have also the staffing and the training to get out there and ensure that a lot of these wounded soldiers are taken care of as best as possible in a much enlightened, and is not enlightened, a much better, airy, or even on top of each other, cleanlier circumstance than you see in previous times. Now, going into the Civil War, the U.S. Army had 113 surgeons. That's not a lot of surgeons. And then they're going to lose some. 24 end up going to the South. So when they're enlisting surgeons, they did have prerequisites, which at the beginning of the war, you're able to be very, very picky. As we progress in the war, you're not going to be as picky. Your training during this time period can come from multiple ways. If you're in a rural circumstance, obviously you have to be able to read and write. And most of the time, those going into the medical trade are not going to be your poor farmers or of the lower working class. They're going to be more of your, what we would consider like a middle class into a trades class and such like that, or even your upper level of society. If you're in a rural setting and there's no medical institution near you, or you maybe can't afford to go to one, you are going to meet a physician. They're going to give you a bunch of books to read. You're going to read up. You're going to apprentice with them, and you're going to learn the trade that way. And sometimes you're actually going to see that being your better route because they're getting a lot of hands-on experience. And a lot of these rural doctors, they're keeping up a correspondence with other doctors within their state, maybe outside of their state. So they're going to be able to see, oh, wait, this person is doing this? Okay, let's try this. They're saying chloroform is a little more successful than ether. Let's go that route. So it's oftentimes thought that if you were in a rural area, you didn't have a good doctor. But again, you may see a highly educated individual living in that area that just did not have the means to go to a medical school during that time period, but is practicing and treating their patients just as well as someone that did go to a medical institution. If you go to a medical institution, you are not going for the full residency and then, as you see today, you might see a person going and studying for about 2 years and then coming out and being like, voila, I'm a doctor. Or you could see them go to one medical institution for 2 years, maybe transfer to another. They may even also try to apprentice or work with physicians of renown in the field to better their understanding. Surgeries, you're going to witness them, but it's not really the hands-on training that you're going to see later on too. So they may be aware of the human anatomy. They may be aware of surgeries, but going into this war, you're going to have quite a few surgeons that may never have performed that actual surgery itself. And then there's the actual enlisted soldiers. Some of them are going to be healthy coming into this war. And again, at the beginning, we can be a bit picky. But as we go into the war, we're not going to be as picky. The folks that are supposed to be vetting those being enlisted in might be paid on the side to just keep bringing in warm bodies. So whereas at the beginning, you had to have, of course, all limbs functioning, you had to be able to breathe easily, had never been had a concussion, had no visible sign of disease, you're going to see that kind of drop down as we go into the years, sadly, of the Civil War. One of the main things, though, that they're always going to make sure that your enlisted men had was their front teeth. That is very important because when you're on that battlefield, you're using your front teeth to rip into those cartilages, which has your gunpowder and musket within it. We tend not to think of that today, but you could have someone kind of limping in and not looking the best. And if they looked and pulled their teeth, went nice and sound, get on out there, boy. They were going to put them out there. You're also sadly going to see those that are not of age sneaking in to the battlefield. And you probably have read reports of boys that basically joined the Civil War later on, basically lying about their age, or even they just didn't care and get them out there, that did survive and talk about it. They're often the few that into the 1900s, like, I think it was a parade. My father even talks about there was a man that was from the Civil War. I think he was in his 90s, obviously. That was, in this parade. But he had to have been one of the younger ones enlisted in for him to see that. With going back real quick to your medicines of this time period, and I talked earlier about how we're starting to see advancements coming about. You are still relying quite heavily on herbal medical treatments. And keep in mind, a lot of our medicines today are often synthesized versions of plants you might see in nature. And there's actually a couple medical universities today that are looking back at medical journals, and they're sitting there and saying, let's do some research. Let's do some tests and see if these items really are antimicrobial and antibacterial. And they're finding out that they are. And if you're using these plants in a much higher concentration than you would probably be using in homeopathic remedies today, you will see them working as a medication we're used to now. A good example is white oak, tulip poplar, devil's walking stick. These are all plants that can be used to fight gangrene along with other types of infections that can spread in. And they were being used quite heavily, especially in the South, because at the beginning of the war, the North and the South are able to produce their medicines. But as we progress into the war, I think everybody knows the South is not able to quite keep up with producing on the level that the North has. So you're going to see them looking around and saying, what other sources can we use? We can only do so many blockade runners trying to get up there and get supplies and bring them back down. So you're actually going to have a herbalist from South Carolina, Francis Poacher. He is actually working within the Southern cause. Samuel Moore, who was the Confederate Surgeon General for the South, was like, I need you to go out there and compile and figure out medications that we can produce down here in the South to be used on our soldiers on the battlefield, because we're not going to be able to get a lot of these medications. So he did compile in 1863 resources of the Southern fields and forests. I used to own a copy. It was like this old pamphlet a couple years ago, and I'm afraid in all my moving, I've lost it. I have no idea where I've had it, or I would have brought it for y'all to see. Emory University down in Georgia, I think, has the original copy. And they're systematically going through and just kind of looking at the medicines that he compiled in it and chemically breaking it down. It's absolutely fascinating what they're doing down there. And they were the ones that found out that white oak and tupelo were good. But you also see him talking about dandelion and comfrey being used for skin disorders. You see sage being used for colds. Horehound. Who all in here has ever had horehound candy? I love horehound candy. You either love it or hate it. I can't explain the flavor. It's kind of licoricey. I love horehound. Horehound would have been used as what we would call a lozenge basically today for sore throats and such. So keep that in mind too. Some of the things we take for granted today for our sweet tooth actually originally had a basis within the medical field and for treatment itself. But he compiled 37 different plants that could be used to treat gangrene. And ironically, within this source, he has found remedies that are ranging not only from your early colonists and those that settled in that area, but he's also using remedies that were used by the Native Americans and African-American enslaved peoples. That's another thing we tend to not talk about enough for some reason in this country when we talk about our medical history. No, I'm not getting on a pedestal, but I'm just going to say that we sometimes forget that there were multiple established groups within this country other than your European colonists who had their own form of medicine that may have been parallel to ours or different, but because when you see physicians looking at them and merging them and taking them, you end up with a pretty wide range of medical remedies that could be used. Many of them, again, through trial and error of hundreds and hundreds of years of use, were pretty streamlined, and we're going to work on their treatment for patients. As far as surgery, there's the mythos that, and I talked about this earlier, you bit on a bullet. You're not going to bite on a bullet. You need those bullets for the Civil War, but also that's a small little object a patient can choke on. That's the last you need, is to be fishing that out while you're trying to sever someone's limb or do whatever else surgery you're doing at that time. You're also not going to apply them with a ton of whiskey. Whiskey's a blood thinner. They're aware it's a blood thinner. You also don't need a drunk person fighting you as you're trying to perform the surgery. Yes, whiskey is used medicinally, along with other liqueurs during this time period. But it's not quite like in the movies, especially the last one. I love Westerns, but the Westerns where you're just kind of like, I also love how you'll be out in the middle of nowhere and someone can always produce a bottle of whiskey or something. Especially when they had a pack that was much smaller than the bottle itself. But that aside, that's just delving into movie lore where it doesn't make sense. But again, it's a movie. They're gonna do what they want to do on that one. You do have anesthesia during this time period. You have quite a few choices, but your main two that you're going to be using is ether and chloroform. Ether has a pretty long history with humankind. It dates back to about 1275. There was a Spanish individual who started really looking into ether. It's really not going to be until the 1500s in Prussia that you're going to see ether stabilized in a lab to become the source that is used later on in later centuries. The problem with ether is it's explosive. It's not very stable. It's not going to travel well. The upside to ether is throughout its history, you do see less complications and less deaths arise from it being used medicinally. Chloroform is more stable. Chloroform is actually an organic material in its use. It can be used around an open flame, which, let's be honest, during the Civil War, nighttime surgeries, that's what you're going to be using to see what's happening with your patients. It is really a more modern item. It comes about in the 1831 by both at the same time, an American and a Frenchman, kind of coming up with this idea, not so much together, but basically using it. But it's 1847 that Sir James Young Simpson is the first to use it in surgery, and he was a Scottish physician who liked to, with his colleagues after dinner, just kind of go to a room and be like, let's try this new drug and see what happens. So I give him credit. He's experimenting on himself before experimenting on his patients. But I don't think we'd be allowed to get away with that today. I think that would be an interesting news story if we found out some of our doctors were taking home experimental drugs and trying them at home and seeing how they did. I don't know. Maybe that does happen. We do have Crawford Long in Georgia use ether in surgery for the first time. And I want you to remember that name because there are other names that are attached to ether being used in surgery for the first time. And they were physicians that basically did it and then put out their medical information right away. Whereas Crawford Long sat there and documented and notarized and did everything he could as he was doing this to be like, let's just try this, let's just try this. He is the first to use it during childbirth with his wife. She had 12 children. I think 7 made it to adulthood. I can't imagine. She was probably like, thank you, for the ether. And it's going to be the open drop method. So you may have seen diagrams where they have like the comb or something more simple. It could be even a cloth that they're going to drip it on and then hold it to the patient's face. Ether is going to take about 17 minutes to set in. You've got all the time in the world, that's fine. But yes. Is
that chlorophyll or ether?
Both of them. Oh. Both would be used in the open drop method at this time period. In the time of war, when you've got a lot of patients coming in, you cannot wait 17 minutes, especially since the amputation should be done between 3 and 10 minutes. So chloroform, again, is going to come to the forefront of the more popular, and that is because it only takes about 9 minutes to set in. Chloroform, though, has a higher rate of causing issues with patients, mainly because if the patient has any form of heart palpitations, you can see it accelerated. We also see a higher amount of patients dying from chloroform compared to ether. But again, when you look at the two of them, you have to sadly go with chloroform during this time period because it's stable, it can be by an open flame, and you were able to transport it a lot easier than ether. That said, so we do have these two drugs during the Civil War. You're not going to see every single patient get it, especially as we go into the war, especially if they have a lot of patients. You are going to see them sometimes say, I'm so sorry, boy, but I'm going to save this for the general over here because we need his mind to keep us going forward. We're just going to do the surgery. If a patient was already out of it due to shock, they often, even with a general, as the war progresses, is not going to use that chloroform or ether because they're like, why waste it? They're not with us. Let's do this surgery and move on. An amputation is even today a pretty scary thing to watch, no matter how precise and clean it is. You're going to have to first remove the flesh away before you can then get down to the bone itself. You do see circumstances where they try to do a break in between of removing the flesh, and you're going to be cauterizing at certain points too. So you do not see that patient bleeding out, if you can, before they go to the bone. But we oftentimes see patients, those that are even aware, being like, oh my goodness, just end it. Just don't give me a 10-minute break, just go. They could either leave the wound open, or if it was done properly, I don't want to say properly, if it was done a certain way, a piece of flesh could be brought down over the open wound. That is, ironically, it sounds like to us today that would be the more preferred method. That oftentimes is going to be the worst method because there is a chance bacteria, and it's just not going to be a clean wound, and you're just sealing that uncleaned wound up. So it may sound grotesque, And it probably was grotesque to those around and for that poor person themselves. But leaving it open, cauterizing it, and then them being able to look at it and saying, all right, I'm not seeing any gangrene forming in this area. It doesn't look like we have any blood poisoning. They're going to be watching the veins, of course, making sure they're not seeing them suddenly showing up and becoming darker. But it ends up being the better means of treatment at this time period for an amputation. Coming out of the Civil War, you're going to see a boom in prosthetics coming about. And ironically, a lot of those that are creating some of the most advanced fake arms and legs are going to be soldiers who are going home. I don't know, perhaps maybe they had a trade going into that war. And they're like, look, this is great what the government gave me, but it's not really doing it. So you see them figuring out how to create hinges in the ankles. You see them figuring out how to create bumpers around the ankles, how it can fit back up into, let's say, the knee joint or up into the elbow joint or wherever and make it far more comfortable. We're also going to see an unbelievable advancement in cosmetic plastic surgery, because there's something else being used early on in the war that is going to cause a whole lot of problems, and that is going to be mercury. Mercury can cause its own form of gangrene. It can basically disintegrate and get rid of bones, among many other side effects that one does not want mercury in their system. And going into this war, you did have quite a few physicians on both the north and the southern side thinking this was kind of a cure-all drug. Person looks like they got a little bit of a sexually transmitted disease, give them mercury. Got a bit of a cough, give them mercury. It's amazing by our standards today. But again, look at the side effects of some of our medications we have now. We've got these wonderful commercials where people are singing and dancing around fountains. And you're watching it going, I just don't get it. And then real quickly, they go through all the side effects that you can have while the person's like just smiling away and butterflies are floating past them. So we're again, in that limelight, we're not quite as advanced as we'd like to think we are. But U.S. Surgeon General William Hammond of the Northern Army was not a proponent of mercury. And so he basically, when he starts seeing the supplies dwindle and limit, he's like, no more. We need to stop this. And again, you are going to have your physicians that dig their heels in and say, no, I want to keep using this. But you also have other physicians who were aware of the dangers and basically saying, oh, thank goodness we can finally stop using this within our arsenal of treating patients. Let's move on and try some other things. And again, you don't just have the South compiling herbal remedies. There were plenty of printed books at this time period talking about medical plants and how they could be used. And not all plants are great. I will say that to get into your system. But they had other options. It wasn't like mercury was the only choice that they had during this time period. Reconstructive cosmetic surgery is sometimes going to be utilized on patients after the war who had had complications due to mercury. One was a gentleman where his cheekbone just was no longer in existence. And there was a New York surgeon who was able to reconstruct that back up for him. And of course, he is writing down what he's doing. He's publishing what he's doing. And it's great. This sharing of knowledge is just going to help all these other physicians read these things and say, okay, I need to go home and practice this on one of my patients that came back from the war. And I need to do some reconstructive surgery on them too. Orthopedic. The science is going into orthopedic treatments advanced during this time period, along with neurosurgery also at this point in time. So by the time America comes out of the Civil War, we're equal to Europe in how their medical knowledge and standards are. One thing you're also going to see during this time period is the improvement of how to get patients off the battlefield. So we're pre-combat medic, but we have what are called hospital stewards during this time period. And it's basically going to be kind of like the establishment of our ambulances that we're going to see later on. You have Jonathan Letterman, who established the ambulance corps. And what they're going to do is they're going to go on the battlefield, and it was like a 3-stage stopping point. You're going to grab your patient. You're going to basically do some quick triage. You're then going to take them to the next location, and they're going to look them over and say, surgery now. This one, go on to stage 3. We can take them there. Patient that might have stayed on there would then go on to the next location, which is where you're going to see lesser injuries, wounds being performed, or being basically surgeries performed on, and you're also going to see recovering patients. So this is the first time you really see someone, or I should say individuals, saying, how are we going to get them from point A to point B and hopefully prolong their life? I find this fascinating because too often, if you go back in history, there's just no thought process of these poor soldiers, your enlisted folks all the way at the front. You know, you just kind of saw them as pieces on a chessboard. Not all. There are going to be those that are in charge of them that really felt it when they lost their men, were fighting for them. But you do oftentimes see it's like, blast, we lost that group. Okay, grab that one over there and just shove them out. I think a good example in a more modern sense would probably be World War II and Stalingrad, where basically you had enough Russian soldiers that you're going to have one in front with the gun, one in fact behind with the ammunition, and you're just lining them and just pushing them and pushing them and pushing them out. I mean, it's scary to think that you're going to do that. I have to admit, they did win at the end, but it's rewarding to also see, and again, I don't think this is really talked about enough when we think about the Civil War and the medical advancement, is the fact that you do have, both in the North and in the South, high-level individuals that are really trying to figure out how they can save these people. Because at the end of the day, you will have those on either side that are extremist in their beliefs, but most people are sitting there and having quite the conscious issue because they're killing a fellow American. They may not agree with their viewpoint. They may not agree with why they're fighting, but this is a fellow countryman that they're taking down. This isn't the American Revolution, although you could kind of argue that point too, to an extent. This isn't the War of 1812 or the Mexican-American War, which again, you are going to have some issues with that to an extent, but this is Americans killing Americans on a very large scale. And it's also an era where we're being able to document it with photography. So you're having this going out into the press and the news. Are reporters today very good at always getting the facts 100%? No, it's the same as back then. So one side that you're going to see is maybe someone that's not 100% focused, probably going into shock from a battle wound. They're seeing an amputation going on. They see the patient thrashing and moving all over and screaming, and they're like, good God. They report that to the reporters. The reporters report it out to the people. They're just butchering these men. They've got limbs piled up chest high, which is true. They're stripped down, and they're just covered in gore and doing this. Well, it could be, not often, always the case, but it could be that patient does have ether or chloroform in them, and they may be having a slight reaction to it, which is going to cause them to moan and move about. They are conscientiously not aware of the procedure going on, but their body is still having a reaction. But you go back over to that person who's waiting for their next line. We don't know their education background. It could be this is some gentleman that came off of in an area that's never seen any type of wound within his life, and he's watching this trauma. He's going to just immediately go to an extreme and think that the physicians are butchers and that all they care about is getting them back up and out and fighting again. We also see huge improvements in the structures that actually are built to house those that are recovering or where surgeries are performed. At the beginning of the war, it's pretty much just wherever they could. They're going to go into a church. They're going to go into this building. But as we progress, especially in the north, you're going to see them starting to establish and build structures that are solely used as basically a hospital. Now, that said, both the north and the south, both governments are trying their darndest to keep sanitation and hygiene and everything as best as possible. But again, you get down to the nitty-gritty, you're not always going to sit there and say, oh, wait, excuse us, the horses are pooing in this area. We need to scooch them along to this other area so that it's not befouling the water and here and this. If you've got a bunch of tired people who are getting ready to go out and fight the next day or are tending to their own wounded, you're going to put those horses sometimes where you can put those horses. And again, you're also going to have those that may not agree with this thought that, you know, they're going to be like, that's nothing. So what? It's going into the water. It's all good. I mean, you're making coffee and tea during this time period. In the process of doing that, you're boiling your water. Oftentimes, folks thought when you were doing that, it's the object going into the water that's purifying it and making it safe to drink. So they're like, oh, we got tea. We've got this item over here. We drop it in the water. It's okay. But you're not going to see in the beginning times of it this sanitation and cleanliness that you would like to see, we'll just say that, at a battlefield or in a medical zone that patients are being treated. And again, you're going to kind of see the North be able to handle this a little bit better as we progress into the war than the South. But the South is also going to be losing some major cities as we progress in. Their supplies are going to get less and less and less and less. And there's a couple other factors that are going to play in. The final thing that we're going to talk about is the fact that when you came out of this war, you're going to see a lot of publications coming about, both from the soldiers, from the surgeons, and everyone in between. That was pretty much that survived this war, seeing what was happening and the outcome of it. And this is where a lot of our resources today are coming from. I will say this, as a historian, you're trained to believe first-person records are always hard facts. You got to take it, that's it. Secondary, third sources, whatever, don't rely on them. I always take primary sources, I hate to say it, with a grain of salt, because we humans are not the best at writing things down as we see it 100%. It could be you're remembering it a little differently. It could be, in all fairness, you don't truthfully want to write certain things down the way you saw it. Or it could be it was written, and then we're not aware it was transposed by someone else at some point. And so you may not be getting all the facts. So if you ever read up on journals and diaries from soldiers in the war, definitely read them. It's going to give you a view into a totally different time than what we're used to today. But keep in mind, sometimes you'll need to go and say, I don't remember hearing about that happening on the battlefield. You might want to look at some other sources. Maybe see some other perspectives from that angle. And I think that's sometimes what happens is when people come and talk to me about medical practices in the past, they've either read a history book and they fixated on one passage, or they've only read one journal from someone that was a witness, and therefore they're just coming away with one point of view. They're not getting as full a picture. And that said, one of the reasons I love history is I love mystery, and we are not ever going to know everything, especially as we go back further and further into time. One of my favorite time periods is Anglo-Saxon England. There's a lot that I'm reading. I'm like, we'll just never know what was going on there. You've got plenty of archaeological digs going on in England where they're coming across Anglo-Saxon burial mounds and this and that. But, there was no written records. And if there was oral traditions, those that continue that oral traditions are no longer around. So keep that in mind, even with the Civil War. It may not be that long ago, but there are certain things that can kind of be a little convoluted by our standards today. That was a lot of information in 45 minutes. I'm going to open the floor now if anybody has questions or... Yes.
What does ether consist of?
Ether consists of... I had to write this down. It is distilling ethanol and sulfuric acid, whereas your chloroform is basically listed as a organic filibration. No, that's another thing. An organic material that was found. So with it gets a little confusing because this is the problem I find a lot of times when you're looking into remedies and they're being discovered is you'll have someone over here that discovered it, and then you'll have someone over here that discovered it, and then they're going to go with this source. And it mainly comes from the fact that for the longest time, when you look at history books, they're really just going to focus on European history. We're going to forget about the whole rest of the world and what medical advancements might have been coming around at that point in time. So it wasn't, you've got 1275, a Spanish chemist is playing in a lab, but it's not a stable version of the ether that you're going to see coming later on. So it really is going to be Valeris Cortis, who in the 1500s in Prussia stabilizes those two to create ether as we think of it today. Any other question? Yes.
Any information you could give us about women in medicine in the Civil War?
You do have women working as nurses on the side. I have to admit, I'm really bad at looking into what women are doing. In a medical standpoint, I find the whole medical lore, herbal remedies far more fascinating. When I worked at Old Salem, people thought it was very strange that an older gentleman, we pinged back and forth between doing the medical talk, he went far more into childbirth and women in medical history than I did. Everyone kind of assumed that that was my forte, and I was like, I'm more into the surgeries and such like that. So you do have nurses, and they're coming away with the practices that you see Florence Nightingale establishing in the 1840s into the 50s and 60s and 70s. You are going to see them working more so at the beginning of the war, kind of further back. At the end of the war, you will see them more towards the front line and triage and such like that. Nursing is going to kind of really formulate into what we think of the beginning of nursing going into the 1900s. As far as any female physicians, I'm afraid I'm the worst person to ask on that one. I'm sorry. There may have been women that may not have been considered a female physician, but had the training and the knowledge. And that said, you go into your rural areas, you do have women with the same knowledge and training going into using medical and herbal remedies, not witches, not like old wife folky. Women that legitimately were sitting there saying, okay, this works for this and this works for this. You are going to have women that are going to be perhaps better at treating a patient with childbearing because they have maybe gone through it themselves and know what's going on. But for some reason, whenever someone asks me a question like that, my brain always pings back to that TV show, Dr. Quinn, Medicine Woman. I don't know why. I just always go back to that. And I'm like I said, you do see women going into this. And even throughout history, you will see women that are chemists, that are mathematicians, and are looking at this and saying, all right, this is what's happening in this field, and they have a correspondence with physicians of standing during that time period, and mainly because it's a lot of time they know no one's going to maybe read their publications, but if they get this to someone they know that can get it out there, at least they're kind of helping advance their field that they're finding all this new information on to go further. Another kind of crazy thing throughout history is before you really start seeing the study of the human anatomy, a lot of times your person that's going to be the best one standing next to a surgeon, can anyone think of what professional would be your best? Undertaker, maybe. Butcher, yes, especially if they focus on hogs. They're usually going to be one of your best people that are going to be like, no, they need that one. You do not want to remove that organ. Yes.
So you're saying the nurse midwifery didn't become popular in the U.S. till for women until it was like early 1900s?
Oh, it is. It's in existence prior. It's just nurses, as we think of today, start really coming about in the 1800s. And as a profession, you see it progressing through the 1800s into the early 1900s into a medical field that we're more familiar with today. I'm not saying you didn't have nurses in other time periods, but it's a term that's more modern, I guess, in a sense of how we see it. You will see women throughout history, even medieval times, that are going to be there and taking care of patients, washing patients. A profession that is sadly not ever really talked about, and I hate to say it, may have been more important than your nurses as a female following soldiers and encampments, are going to be your laundress. These women that followed soldiers around and washed the clothes and the bed linens are often women that no one wants to talk about, but were very important because they're going in and they're cleaning up the muck and they were washing things. It could be they were camp followers in the sense that they had family members that were serving. It could be women that just saw an opportunity for a career or for money. But it's a group of women that are just kind of throughout history following in the background quietly, because no one ever sits there and talks about, well, those sheets look awfully clean, especially if you look at medieval times. How was that done? That was a profession that you would see. I have seen some people talk about the fact that they didn't particularly want to talk about them because then you would see them raiding the bodies on the battlefield for, it's like you got like a half gypsy, half laundress out there taking jewels and stuff like that off people. It's not all gypsies are bad. It's like these lovely little categories we like to put people in for books and novels and movies that just kind of somehow work their way into mainstream. But no, midwifery was important. It's kind of like today. We tend to have this viewpoint that because it's a woman and she's in midwifery, she's going to know more than a physician. Sometimes she does and sometimes she doesn't. It depended on her training. And if she did train or apprentice with another woman in midwifery, that was well established and well respected. Thank you.